Folks, Nick the Nurse here. Today we're going to be talking about some of the signs and symptoms associated with the nursing problem of peripheral artery disease. Let's get started. With peripheral artery disease, one of the main nursing interventions is that you want to make sure that you monitor vital signs. Big thing. Encourage the patient to take part in moderate activity to increase circulation. Also a big thing, and that could be something as simple as going and exercising in the swimming pool. Low impact, right? We want to make sure that we get those veins and those arteries pumping and taking blood to and from the heart, okay? Very, very important. We want to assess the patient's pain level, because oftentimes in peripheral artery disease, it could be painful, especially in the lower extremities. We want to encourage the patient to elevate the legs, but not above the level of the heart. We want to assist the physician in preparing the patient for balloon angioplasty or stent placement surgery if indicated. We want to assess the patient's skin for breakdown because in peripheral artery disease, especially in patients who are diabetics and might have peripheral neuropathy and aren't really able to feel their feet or their toes or lower extremities, they are at risk for developing ulcers, arterial ulcers on their lower extremities. They can develop venous ulcers too, but here we're obviously talking about peripheral artery disease. We want to make sure that we watch out for that. So assess the patient's skin for breakdown. We also want to encourage the patient to be compliant with antihypertensive therapy, right? We want to preserve those vessels in the heart. We want to make sure that we administer anticoagulants as ordered. We want to assess the patient's peripheral vascular status, okay? We want to do that every shift. We want to encourage the patient to stop smoking because smoking can lead to peripheral artery disease. We want to instruct the patient to avoid crossing their legs and avoiding constrictive clothing. Those are things that they need to stay away from. Additionally, we need to educate the patient on making food choices which are low in fat and low in cholesterol. Those are things that we need to encourage them to do. So obviously a lot of different nursing interventions that you need to be familiar with in order to do well on your nursing school exams and on the NCLEX. Go through them. You feel free to watch this video again or check out any of my other free nursing videos at www.nickthenurse.com. Again, that's www.nickthenurse.com. There is no obligation, no commitments, no nothing. Check them out. They're free. It's free information. Again, nickthenurse.com. I appreciate you watching my video today, and we'll see you next time.